must do this live because I've promised my fans too much. Abba, I'll promise I want to teach us how to do live, how to do pregnancy test live. I will teach. Anytime I want to teach about this, I want to talk about this. Do you know that day there will be no network? Or either that day, yes, network, especially network, or something will happen. Now, guess what? I was at work, no network at all. So I'm now home. Now I'm seeing some network, slight network, even allowing me to come online. Praise the Lord, glory be to God. So now I'm live now. I'll be using just one sample for today because it's not be easy. But I was able to get another samples. Okay, it was not easy, but I'm still going to teach you, show you everything. So please, you'll be hearing some kind of background noises. Probably you hear noises from my wonderful kids. You'll even be hearing where I'll be shouting at them to probably keep quiet. So please, all you need to do is to bear with us. Okay, this is a sample. You have to bear with me, but I will try as possible I can to make sure you all are following me. So you all are welcome to my channel. Thank you for joining me. Thank you for joining me. There has been so much rain today. The weather has been cold. Rain. Okay, so rain. Weather has been cold. So thank you all for joining me. You're all welcome. So we'll be talking about pregnancy. Yes, so I said I will teach you how to carry out pregnancy tests. I'm here with all my things so that I have the sample, my own sample. Then I have strips and also a lot. So I will say that I will still tell you people the signs of pregnancy first, okay? And I have my, a little book that I've brought out something. Sorry for where I am now. I'm at home. The network came. As rain fell today now, the network just got me so bad. Network got me so very bad. Unless I would have come online by 12 now. I usually come live by 12 to 1, 2. But what shall we say? We give glory to God. Okay, so the weather is cold, it's rainy, and we are those persons that want to do huggy. So after doing the huggy, and the pecky, and the there is always a result. The result is that you either buy Pampers or you will not buy Pampers, or you go and meet pharmacists or even doctors or whoever. So you know what I mean. Or you end up buying Pampers and be a daddy or a mommy. Or finally it might be that after the oggy you are just free as free. Okay, so there are even how to calculate ovulation and to know your safe days and your days that you are not safe. Okay, so if you would like that, I want you to put it down in the comment section so that in my next live probably will talk about how to calculate ovulation. I will come with a calendar, then we'll do it better. Okay, but for this one, it's all about pregnancy and signs of pregnancy and how to carry out the test. So because I know a lot of people say, hey, I know how to do it. Yes, so a lot of you know how to do it, but there are some persons that are still coming up that don't know all these things. Okay, that is why I got my sample here, and also I had some strips that I've used. There is one. Go and read, my dear. There is one that is here that is showing some. I'm going to teach you a lot today, so please stay tuned. And I'm sorry for everything that's gonna be because I am at home, so the home environment and the scenario, everything is gonna be somehow. But notwithstanding, we move because we're gonna get what we want. Okay. So now, now let's look at the early signs of pregnancy. Okay, what are those signs that some persons will feel when they are pregnant? Those are the early signs of pregnancy, I call them. Okay, then the number one sign of pregnancy is A missed period. I know a lot of persons know this one. A missed period. Okay, after all the oggy and the lovey and dovey, the lovey-dovey things that you did last month, okay, this month you haven't seen your period. It's a sign that you might be pregnant. Okay, if you're the type that you're seeing your period every month on a normal, you're always seeing your period every month, and you know that you've missed a period, you should be thinking if you're pregnant or not. Okay. Also, guys, you have to excuse me a bit. I'm coming. Okay, sorry about that. Okay, sorry about that. So as I was saying, now the number one sign is a missed period. When you haven't seen your period for some months, like if you have not seen for 1 month or 2 months, you should suspect yourself that you are pregnant, and you should go and carry out this first step of pregnancy that I'm going to teach you. You should go and carry it out. Okay, so I'm going to teach you. This is just like Sharon, this is just like a first step before you go and confirm with your blood, because we are using the urine. Okay, before you now go and confirm with your blood, or you go and do scan to confirm. Okay, hi Sharon, thank you for joining. Please like. Thank you. Then the second thing you're going to feel if you're pregnant is morning sickness. Morning sickness. You woke up in the morning, you feel like you want to throw, like you want to vomit, but nothing is coming out. Okay, and sometimes you even used to vomit. All these signs I'm talking, we are fucking. I have a problem. Please, you can put it down in the comment section. I'm sorry for the background noise and everything. I am at home, I'm not at work, so the children, neighborhood, everywhere. So please, let's just manage the noise, my voice and everything. I even forgot my my mic. I forgot it at work. I usually do this at work, but since I promised, so I just said I must do it. That's why I'm doing this. Okay, so thank you. You can put any problem you have down there. I'll be seeing it. Let me continue. Thank you, Sharon. So morning sickness is very bad. I'm talking from experience. I told you there are children now, so morning sickness is very, very bad, in the sense that it should be giving you that shocking effect. Like you cannot even eat good food that you usually eat. Okay, so that is another one. Then morning sickness, I have to explain. It's just like you want to vomit, you are not feeling like to vomit. Sometimes you vomit a little, sometimes you vomit very much, or sometimes you are feeling somehow. Okay, that is morning sickness. Then also tenderness of the breast, tender or full breast. Okay, those when you are pregnant now, your breast will be fuller, heavier, like a hair. You have seen it. This now, it's like I've been trying to get pregnant, but I don't know the problem. Okay, your own is trying to. Okay, that I think you should after this life, you should go ask my comments. Go to my go check me out. Let's see how we can do on WhatsApp. How we can talk on WhatsApp. Okay, I've been seeing blood like 1 week. Okay, after my period, I have been seeing blood like 1 week. Okay, then I think yours you come into my DM. Let's discuss better. Okay, because yours is like kind of like opposite of what you're talking about, because now I'm talking about how to carry out pregnancy tests, but you should watch out, because so that you'll be able to know how to carry out this one to check for yourself too. Okay, so I'm talking about signs of pregnancy and how to carry out pregnancy tests. If I answer your questions and get this thing, it will interrupt the flow that I am. Okay, Sharon. Okay, so please, I think you should DM. Let's talk better. Let's see if you're having some hormonal challenges or not. Okay, then I said tenderness of the breast will be very full. The breast will be very full, and even you too, you feel like your breasts are feeling different. Like when somebody touches your breast, you'll be feeling so sensitive too. Very sensitive in the breast, and sometimes even in the nipples too. It used to be very sensitive. Okay, and the breast will be heavy, as if you haven't started breastfeeding. Okay, then The number fourth thing is that there will also be implantation bleeding, light bleeding. Okay, this bleeding occurs when you are pregnant. Okay, it's just like implantation because there is a process in your body. There is a developmental process in your uterus. Okay, so the uterus will bleed a bit. That is, we call it light bleeding. Okay, it's not like your period type of bleeding. Okay, we will call it like how they call it, spotting. We say it's spotting. It's not like full this period that you will see. Okay, so maybe after 1-2 days it will stop. That is called spotting. It means you are pregnant. Okay, not only that we tell you are pregnant, if you have missed a period, your breast is full and tender, and you're having nausea, and you're noticing that you're spotting, you should think, or you should believe that you are pregnant. So you should go and carry out this test that I'm going to teach you at home by yourself. And for some persons like me myself, I don't used to spot. Okay, there is no spotting for me. So for you too, it might be different signs and symptoms. I will always tell every woman, in your first child, you should get the signs and symptoms very well, so that when you notice it in your second child again, you will know that even before he enter, you say, I don't get belly. You confirm it yourself too. Okay, so please, the like button is there, the thumbs button is there. You should like that thumbs button. I think it makes this video go viral to other people too. Okay, so please subscribe, and this thumbs button, please put it on. Just give it a thumbs up. Okay, then the fifth one is mood swing. Yeah, there are a lot of persons that usually have mood swings. Yeah, I do too have mood swings. Sometimes I'll be happy, sometimes I'll be sad, sometimes you can even just sit down and feel like you should just cry throughout the day. That is called mood swing. Okay, mood swing can happen to anybody. Okay, so that is it. So if you're a man and you're following me, you should know that when your wife have unnecessary mood swing, like she's feeling sad, after a while she's happy, this, and you're noticing some changes that I'm telling you right now, you should just go tell her to do this pregnancy test to check if she's pregnant or not. Okay, so as a man too, you should watch out for your woman, just as the woman is watching out for herself. It's two-way thing. Okay, so because it's two of you that do the lovey-dovey. So also the number 16 I would like to tell you is bloating. Yeah. I just wrote down the points and I'm reading out. Bloating, that's one. You even think that you are having ulcer. Okay, there is somebody that came to the premise. She said she's feeling some movements in her stomach, that the thing will move. Yeah, move there, but she's done urine and is negative. That is, she's feeling movement, her breast is kind of thing. I say, yes, ma'am. I can't just conclude with that. Come, let's do pregnancy test, or if possible, do scan. She said she's done pregnancy test. I said, come, let's do scan. Pam, that was how she went, and she did not come back again. So I think she's pregnant. Okay. So I think she did the scan, because sometimes scan will tell you if it's too early ahead. That is where you'll be having 1 or 2 distance. But scan will still tell you that yeah, there is implantation, there is development. Okay, scan will tell you everything. Pregnancy test too, the blood is very, very more active than the urine. Okay, so you can also use the blood. If you know you don't know how to use the blood, go to any facility. It's not expensive. Okay, less than 2,000, you've done it. Okay, that is it. Then mood, bloating. I said bloating occurs in almost every woman. Oh, you eat small food like this, it will be as if you have eaten the whole heaven on earth. Your tummy will be so full. Like me, I can't even try eating Indomie table, because if I eat Indomie table, the next thing is to start throwing, spitting. Yeah, okay. Is it spitting or salivating? Salivating is like you're having the saliva in your mouth. So it's spitting, yeah. Point of spit, pam. Okay, that is another sign of pregnancy too. So a lot of people use bubble gum to eradicate that too. Okay, so this is just like So if you're a lady here and you've had pregnancy, or you have been pregnant, okay, let me put it here, and you have ever been pregnant or seen some signs, please put it down in the comment section. Let's gist more. Okay, because this is like live section where you talk, okay? So no much thing of hair, because I know there are a lot of ladies here that have been pregnant for. So put it down. Let's say bloating, and also eating too much or too less. Okay, you can decide that some persons it makes them to eat too much, like they want to eat. Yeah, there's someone that came for scan. She's 2 months plus or 3 months. She says she eats every time. But now if you see her now, me now as you see me, you say I'm not fat, because she's and she said that every time she want to put the food in her mouth, she want to put the food in her mouth, she wants to eat. You can imagine. I also that I beg, this is the developmental stage, so allow the baby to enjoy, eat very well. So when you're in your second trimester or in your third trimester, then you can now start cutting down your food level. But for this developmental stage of the baby, allow the baby to eat. Or if you know that it's too affecting you too much, you can just use fruit, supplements with fruit. Like you can go get bananas, apple, pears. There are cheap fruit around in the market that are so safe for your baby and you, so you can just go get 1 or 2 fruits and join and complement and eat. Okay, so that was what I told her, and she was happy because she said yes. So instead of she to be eating maybe biscuits, or maybe eating more of the swallow, the rice, the eba, or the whatever, she said it's better you should take the fruit, and she was happy and appreciative. So you too can take that if it's making it a thank you for the like. Oh, this person that give me this life, thank you. Okay, then the number 19 is mild cramps. Like, yes, I used to feel that. Okay, just the first week of implantation, you will have cramps down in your abdomen. Okay, cramps, sometimes it will not be as painful as that of your menstrual pain. Okay, it will be like something is happening in your body. Sometimes even you too, you will feel it, you will see this movement that shows that something is happening in your body. Okay, that is the cramp I'm talking about. Okay, you will see the cramp will not be as much as if you're the type that when you're seeing your period, you used to feel heavy cramps. When you're pregnant, you will know that you will just feel slighter cramp, and you will be especially in the night, you'll be feeling some kind of developmental stuffs around your body. If you're that sensitive type like me, you will feel it. That you just it. If you're the sensitive type, you'll feel it. Then the number 10 one, I know this is not the final one because a lot of people with a lot of symptoms of pregnancy, but the 10th one I want to tell you is weakness. General body weakness. Okay, weakness. A lot of women usually have weakness. Okay, you can see that to wake up in the morning is a problem. To continue the day journey is a problem. Okay, so that is its weakness, and you'll be thinking that you're having malaria, typhoid, because you can imagine you woke up in the morning, you're feeling like to vomit, you're feeling like to chew, but it's not coming out, you're feeling so weak, you're having headache, you're feeling like that, then you will feel like it's malaria and typhoid. Okay, let me tell you a story. There was one nurse, there was a nurse, a patient came to her side, and this woman was a woman of childbearing age. Okay, but she haven't had any child for a long time since she got married, for years. So she has been praying for a child, but she came to the health facility. This is a life story. She came to the health facility with complaints of malaria, that she's having headache, severe headache, she's feeling tired, weak, she's feeling like to choke. And she was like, see, no, I'm having headache. I'm having malaria. Okay, so now the bad thing the nurse did was that the nurse did not say, hey madam, since you have childbearing age, let me take your blood sample, let's run some malaria and typhoid tests to know if it's really malaria. I didn't run the blood malaria and typhoid test. Do you know that it would have even come out malaria is there, typhoid is there, but she would have added pregnancy. In every woman of childbearing age, try to add pregnancy test. If you're a pharmacist that you're following me watching now, okay, or if you are even watching, you should try to always add malaria, typhoid pregnancy and your blood level, especially pregnancy if you know that you're sexually active, okay, so that you won't go and terminate any child anyhow. So in the process, the nurse gave her injection that is not very good for children, that is not good for children, that can cause harm to the children. And depending on body physiology, there are some injections that immediately some persons take it, it will be as if you are causing abortion to the person, okay. So that was how she lost the baby. Later, it now resulted to, when she was now feeling the pain, they then went to hospital. They then noticed that she was pregnant and she's trying to terminate the baby. All of a sudden, to cut the long story short, it busted out, okay. So please, if you know you're a lady of childbearing age, always go to the health provider. When you go to the health provider, don't just go and tell them you have malaria. Allow them to do their work. You people confuse us too. Allow us to do our work. Don't just argue. Just more money to do tests. Don't just argue, say hey, it's malaria, you just treat it. No, okay. If somebody is treating it, means you are involved. The person is, the health provider is involved. You two work together to make yourself feel better, okay. So these are the strips that I'll be using. You can see, so that when you want to buy, you can get them. HG, this one is pregnancy strip. Let me use it, okay. Hope you're seeing it. Okay, look at the back. Okay, you can see there is urine, okay, urine. So you can use this for urine, and also you can use it for the blood, but the blood is quite complicated, okay. I can't teach you that. If I want to teach you that, it will be a long process, because you cannot still take your blood by yourself, okay. That will be like a section that I'm going to teach. If I want to teach, I will just teach health provider, okay, health providers, okay. So this is a pregnancy test strip, and you can use the for urine or for blood, and results will be ready after 30 minutes, okay. So I will teach you the right way you are going to immerse, put this into the strip, okay. Easy to use, accurate, and fast, okay. So now this is my sample here. This is my sample. You can see this is a urine sample, okay, collected today. I know a lot of people will say, I don't know why the question have not popped up. Okay, I think this question should have come up. Is it that it's early morning urine? Is it that it's early morning urine? Because I know some people say, it's early morning urine that works well, low. Is early morning urine? Yes, I forgot to mention this signs of pregnancy. When you're pregnant, sometimes your urine can be foaming. Yes, your urine can be foaming. You see this urine like this now, some people that are pregnant, it's used to foam very well, okay. That is also a sign that the person is pregnant, okay, foaming urine, okay. So this is the sample, and this is the strip. So let's open the strip and see the process. So this is the process. A lot of people are not joining. Join, like. Is it because I did not start early from 12? Join, like. Okay. You see this thing that you see inside, huh? Please don't eat this, or you will discard it. This is just a preservative. You will silica. It's silica, okay? Contains silica gel for moisture absorbent, okay. It's to absorb moisture that will be found inside here in case, okay. So you throw it away. So this is the strip. Okay, so look at it here. This is the strip. So you're looking at this line here. So this part that is written, this HG, this is the part you are going to be holding with your hand. This is the part that you are going to be holding. This part is a sterile part. You are not supposed to touch this sterile part, okay? It's only this part that you'll be holding. And if you look at this well, they will say maximum. You can only put this thing inside your image it, like, look at it very well. I wish it can show very well. Okay, this place you're seeing the maximum It means that is how far you can go by putting it, dipping it into your sample. That is how far you can go. You shouldn't exceed that line. Okay, so if you're putting it into your urine, you should exceed this line that is there. That is what it means. Okay, so this is how you are going to hold it. You don't need to hold it like this, it's very bad. You don't need to hold it like this, it's very bad. This is how you are going to hold it. Okay, so please like. So this is the sample. Now let's look at the procedure. It's very easy. You do it in your bedroom. When you go to your bedroom, you quickly go, you do it. Okay, so look at it. Today joining of the life is quite poor, but very poor. What shall we say? So now let's see how it goes. So look at it. Look at how I'm imaging the stuff. Okay, I've stopped. You see that it's moving. You see that it's moving. You're seeing it started moving. When the thing have started moving, when you've noticed that there is an upward flow, you can see. So when there is an upward flow, you remove it. Okay, okay, you can see that it's moving. Yeah, okay, so I'm going to cover it. Look at it. I'm going to cover it. I'm going to cover it. And I'm going to keep it on. So after 3 minutes, we are going to read this result. Okay, after 3 minutes, we are going to read this result. Okay, so I don't know how I'm going to be keeping it so that you'll be seeing it. Okay, because I'm already seeing the results already. I'm already seeing the results. Okay, am I pregnant? Am I not pregnant? Who is asking that question? Okay. Okay, so now, is it 3 minutes yet? So you wait till after 3 minutes, but right now I don't even want to wait till 3 minutes. So let's check out. You will see that one line is showing. It means it's what? It is negative. I don't know how you can see this one line. Okay, I don't know. Yeah, I think it's showing better now. Okay, you can see that it's one line. It means it is what? Negative. So I told you that I brought other samples here that I've done to show you how 2 lines will look like. A faint 2 line, early pregnancy, a faint 2 line, and a very bold 2 lines. I brought them out. You know, when I started, I told you I brought them out. So I'm going to show you how the 3 will look like so that you won't listen. So you'll be interpreting the result for me now. So look at this. Oh, how possible can this show very well? It's very hard for you this to show very well, because what I'm holding here is a faint one. This is a faint one. Let me see how possible you can see this very well. Okay, it's quite hard though. Yeah, this first one is a faint positive one because you can see it's faint line. It means that it's early pregnancy. Remember, the person is just some months gone. Okay, then this is a very thick positive one, it means sorry, a very thick negative one, it means the person is not pregnant. Okay, then this is two lines. Okay, this is showing very well. It's two lines, it means the person is pregnant. The person is very, very pregnant. Okay, the two lines shows that the person is pregnant. The one line shows that the person is not pregnant. So if you are with your paper and pen, please write this down. Okay, write it down in your book. These two lines that you are seeing, and I told you, when you imagine it into the fluid, the urine, you shouldn't pass this maximum. You shouldn't pass this line here. Don't pass this line. Okay, don't pass this line here. Okay, so when you put it to this part, you saw as I was doing it now, and then how to read it is that when you saw the procedure of how we did, how to read it is that 1 2 means it's a positive pregnancy result. Okay, a positive result will give you 1 2 2 lines, not on this side but on this side, 2 lines. So you this person is pregnant, then a negative result will give you just 1 line. Look at it, a negative result will just give you 1 line. Are you seeing the difference? Look at the difference now, a 2 line and a 1. Can you see? Are you seeing it? Yeah, this is a 2 line and a 1 line, meaning this is positive, which is 2 line is positive, this 1 line is negative. Then also I brought another one again, because these are the 3 that you are going to be likely seeing, and this is the confusing part. This is faintly, very faint. You can see that this one is bold, the negative one is showing bold, but this other one is a faint line. It means the pregnancy is very early. The person might be let me say 1 week or some days, not up to a week or some days pregnant. A very early pregnancy, that is when it will give you this faint positive line. So the person should check after 2 weeks or so. You will see that it will now come out this big positive line. Okay, I hope you're getting me. Please, if you're not getting me, please put it down in the comment section, and if you're following me, please like. Though I know that the persons that are in there are very few, as I'm seeing it from my side, it's very few. So this is to show that it is positive. 2 line, it's positive. Then this 1 line, just 1 line, plain 1 line, as in nothing is accompanying it. It's just like very negative. This one bold, you should say nothing did there. Now 2 line without mistake. So to those people that say, is it early morning urine, afternoon urine, it doesn't matter. Please, it doesn't matter. They used to say early morning urine give back the best result. Please, it doesn't matter. If you are pregnant, you are pregnant. You are urinating. It doesn't matter the day. Okay, early morning urine. So what if you have been urinating and still early morning urine? So please, it doesn't matter the time of the day. Okay, you take your urine sample. This one I'm using container because it's sample. I have samples, containers. You can just use your basin, your cup, anything that you know that is dried. Okay, that you know that is dried, that water will not contaminate the urine. Okay, you know it's dried and you know it's neat. You just take your urine and go buy your kits, your first kits. Look at it, it's very cheap. Okay, I got these 2 for, it's already in my pharmacy now, so I got them. Some places they sell it 100, some places they sell it to 200. Okay, 200, but highest 200, 250. Some they sell it 500, 1000. Okay, so you can get it to 200. There is some for ovulation too. Okay, you can get it and you try doing out your carrying out your test. Okay, so this lovey-dovey period, please, oh ladies, lovey-dovey. Go and get your so that you'll be able to check the result. Okay, this is a positive result. 2 line shows is a positive result. 1 line shows the negative result. Okay, so for people that are joining me now, let's try use this one to try another one again. This is a new one that I've not opened. Let's use it to check another one again. The first one was negative. Okay, so let's check another one again. Then you know I've told you now. This thing, look at it. Look at the way it entered my hand. I'm trying not to use my hand to touch it. This thing, silica gel, to absorb every moisture that is found in the paper. So you throw it away. Throw it away. Hey, have kids. Let me keep it here before somebody go and pick it and eat it. This is my children. Okay, so you keep it. So I think I need water. So look at how to hold it. Don't go and hold it here. Here is sterile. Sterile. Don't hold it in this part. Hold it with this part. Okay? You hold it like this. And look at it. This is the highest you can emerge this. This is the highest you can go. Put it down to here. You stop. Okay? So this is our sample. Collected accurately. The accurate collection is just urinate inside any thing, you know. Urinate inside any neat cup. Is it cup, bela, or what would they say? What would I say? Is it plates or basin? Anything that I beg that is you can use in your bedroom. Urinate inside of it. Buy your strip of 200 naira. Hold your strip, hold it by this side that they wrote the HG. Every other one they have it like this. Just hold it like this. Then this mouth, you put it and you make sure you don't pass this maximum place. Please, like, I want this video to go viral because this video is too important for it not to go viral. Please, I want this video to go viral. Then look how you're going to image it. So I hope you're seeing it. Yep. You can see I'm not putting everything. So half of it, put it. When you start that, it's like, okay, it has started moving. You see why I say it has started moving? If you can notice this place now, you will see that the thing is going up already. You can see now, it has started moving. See? You can see, so when it starts moving now, I'll remove it and keep it for 30 minutes. I said that, sorry, for 3 minutes. Let me keep it for 3 minutes. I hope you saw how I put it, oh, please. So I put it. So you keep it for 3 minutes. Close it. So after 3 minutes, you read your result, huh? So let me just hold it like this. So it's simple, oh, in your bedroom, in anywhere you can do it, oh. These are the strips that you're gonna use them, huh? And as I told you, you throw away the silica gel. Okay. Okay. Pregnancy test gone wrong. The lovey-dovey. Are you sure the lovey-dovey stuff is me that has not been doing it? I beg. Okay, oh, come on. Okay, It's a negative one. Okay, it's negative, so it means it's negative. Please check. One line is negative. Where are the other ones themselves? Okay, okay. Two lines. Two lines is positive. Bam bam. Confirmed. This one is confirmed one. Two big lines. Confirmed. Positive. Then one line. Look at it. Negative. Then I told you that this one that is faint like this. That is faint. A positive and a faint negative. I don't know how sharp your eyes can be to see this. I've been trying to put this. I don't know how it's gonna be like in the screen. It's not sharp enough. I don't know if as I'm not seeing it you can see it. Maybe it's because of okay. You cannot even still see it very well. You're just still seeing the negative. But me that I'm looking it directly, I can see a positive and a faint line. Okay, so please, that is early pregnancy, as I've previously said. That is early pregnancy. This one, you can see the even small blood there. That is to tell you that it was blood test I did for this one, but I just carried the results so that when I'm showing you, I will show you the difference. Okay, so please like I will show you the difference. So any question you have, just drop it down in the comment section. Let's discuss about it. Okay, so because you are seeing me using this container, you can still go and buy this container. It's not expensive. Go and buy the container. You rinse it when you buy it, because there is EDTA inside. There is something inside there. Okay, EDTA. So anytime you buy these containers, you rinse them very well to remove every it's not expensive, probably 100 naira or 200 or 15 naira. So when you buy these containers, you rinse them very well before you urinate inside this container. Rinse them to remove the EDTA so that you will not be having false results. Okay, before you then urinate inside, then you take your strip, dip it to the points that I tell you. These are points. Dip it, then you keep it. After 3 minutes, after 4 minutes, after 5 minutes, you go and check your results and you know your status. The status is either you are going to buy Pampers but please buy Pampers now that Pampers have not reached 50,000, because when Pampers reach 50,000, if that is when you want to buy Pampers, you will know. So you know that you buy Pampers, or you're free like a bird, or you are going to meet us, a health provider, to do, you know the thing. You know the thing, oh. There was this BB channel that followed me last week, that was with me last week. She's not joining me to come and learn how to do this pregnancy test today. She tried this house, she said she will join me. Funny one. So these are our results. Let me keep this on here. A positive, a negative, and this thing. So as I told you, the signs of pregnancy: mood swing, weakness, nausea, morning sickness. The person will have morning sickness, which is nausea, vomiting, tenderness of the breast, heavy breast go full. Okay, I use beginning, so the breast go full. The person go dey miss period, the period no go dey show again. It means say you don't figure belly be that. So if you say I never see my period, I ask you where you go drop them. All those naive small, I never see period. Where you go drop them? I go drop them for bush. Please, you know, drop them for bush. It means say you have swallowed frog. Yeah, you have swallowed frog. That is how we used to say it in pidgin English. Don't mind me. So it means you're pregnant. Okay, then also mood swing, say you go dey vex, sometimes you go dey vex, sometimes you go dey happy, bloating, your belly go big, small food you chop, you don't tire, you know, if you chop again. Sometimes now you go dey chop, like say now you won't finish the whole world food. Okay, and also cramps, like you be feeling too much cramps in your abdomen, lower abdomen. Okay, Then some people can also feel implantation bleeding. Implantation bleeding occurs a lot in a lot of persons. Yeah, implantation bleeding, that is spotting. We call it spotting. Implantation bleeding na big English show, but small English now when you see small blood for your pints, for your undies, they stay no big like your period, but they see how small. It means say baby they enter your belly, so the baby they develop. The baby they develop. As they develop, your uterus changes they happen. As the changes come they happen, now you go come they see them as small blood for your body. Now that one now we they call spotting, and this implantational bleeding. Implantation means say fetus don't they form for your body, for your uterus. Okay, uterus na the womb. So you don't form for your womb, small. So as they form now, anyhow small changes go there your body, and when the womb no fit come take, and you go come see small wound bleeding, they come out. Okay, you're gonna see am small for your pad. When you see like that, no fear. If you don't too much say they come out as period, and you know say you get belly, na that time you go fear. But if you dey see the small ones, and you know say you get belly na small, maybe for 2 days now you come out, no too fear. That one na normal for early pregnancy. For the they call am first trimester. First trimester na this first 3 weeks. Sorry, my dear, that first 3 months. Like first 3 months na first trimester. The second 3 months na second trimester. Then the third 3 months na be the third trimester. You know say pregnancy dey for 3 phases. The first one, the second one, and the third one. So that first one, plenty things they happen for the body. Now they still talk about this implantational bleeding. Okay. So now for this first time now you get to see the mood swing. Some people don't go chop for this first time. When you can't reach the second trimester, you go come see say you no go even feel chop again. You go come tired to chop. Okay, now so it be. Now keep this now so it be. And also weakness. Like for me now, this first trimester now, so I go to vomit. Sometimes I go to vomit. Anything I eat right now, sometimes this thing they smell. Now so sometimes perfume self they smell. Now sometimes you go see say small time you don't pour saliva. You go see some women then when they come do scan for this thing, they go carry bottle they come because they know say every time. That one now they don't spit. You go to pour spit saliva every time. All those on self you can use chewing gum, you can use any sweet thing to chew so that you will not be pouring saliva all this time. All those time once now they call them first early signs of pregnancy. Signs of pregnancy means the early things where you go notice for your body when you don't get belly. Okay, when you don't get belly, the things when you go fit notice, the changes when you go call for body. And for women, hey, every woman, this one it need to pass any woman. Every woman when you get belly, your breast go full. That one are normal. Your breast go full. Okay, the breast go full, then the tip of the breast now go come they pain you. When you hear this and somebody just mistakenly touch your breast, if you go say yeah, it means something don't happen inside your body. So the tip of your breast go dey pain you, and the breast go dey very full. Okay, I know why they take am serious. They talk am for good English and they talk am for bad English too. I don't use good English talk first, now they talk am this thing, because now they talk am for bad English because a lot of people don't know. Now we when they the field of the medical field, when they the field, now you know say a lot of people don't know. You got to say you know, you don't graduate, but man I tell you, as you graduate, another person now this as you graduate, now that time another person don't reach 18 years, 19 years, and that time their body juvenile distance them. You understand, all those hormones then they high, and that time I don't go feel misbehave, that they don't know whether they don't get belly or not. So now this video, now I say make una dey like so that this video could go viral. You go reach everybody so that they go know how to carry out simple pregnancy test like this one before you go this thing. May you no come think say pregnancy and malaria, because all of them sabi get the same signs and symptoms. Okay, so plenty other things there if you notice for your body, instead of running to go treat malaria and typhoid. Make you go try carry out pregnancy test first to know whether you are pregnant or not. I've done well, you guys too have done well. Thank you for joining. Sharon, no, Sharon, I know you must have gone, so please just put all this question down in any of my video or in my DM. If you go to my page, check very well, you might see my email. You see my email or you see my WhatsApp number. My WhatsApp number is in some of my videos, so where I made you can ask your question. You can check my WhatsApp number and chat me up. Let's see how it goes, because I think this your case is that you have hormonal imbalance. After my period ended, I have been seeing blood like 1 week. After period, you are still seeing blood. And it's not like 1 week. Implantation bleeding will not occur for like 1 week again. After seeing blood, it will not occur for like 1 week again. No. So after you've seen your period, there's still bleeding. That means there is something wrong with the hormones. If that is not what's used to, like you have even seen it for 1 week again, it means that you are having hormonal issues. You're having hormonal issues, like you need to go and carry out some 1 or 2 laboratory tests to know exactly the hormone that is worrying you, that is disturbing you, that is making this occurrence to come. Okay, so that is problem with period. And as you're trying to get pregnant, I have a lot of videos on things that you can do, tips to get pregnant. Okay, so if you're trying hard to get pregnant, then you can just go for your like I said, evening primrose help to balance hormone. There's this folic acid too. These are pregnant care conception. Okay, I think that drug have all the necessary vitamins, the mineral and other things that are going to help you to get pregnant. Okay, that pregnant care conception is very, very good. You can try it out. Then but before then, you should check your hormones to know why this is occurring. Okay, Sharon. So thank you. Don't worry, when you put it down, we're going to talk more and more. So thank you guys for staying tuned till the end. We have done like 2 tests. We have carried out like 2 tests, and we have seen the results. Okay, this sample has done a good job, so we are going to discard it and pour it away. So please, if you don't understand all what I've been saying, you're just joining and you don't understand, you can still put it down in the comment section, or you go ahead and watch the live. So this is the strip to buy you if you did not see it well. HGC drain. So thank you guys for staying till the end. Darian, come and get me water. Let me drink water. I'm tasty. I'm gonna discard it, okay? Give me water. So thank you guys. Please like. I can see that no much person like full pure water. Thank you. Please like, subscribe, and see you next time. It's called Fido. In the next video. Yes. Thank you guys. See you next time in my next video. Bye. Please don't forget to like. I beg. More can I just like.